Hi, everyone. I'm Rachel Dungan, and I'm going to tell you about the tool to cultivate conveners and collaboration in research, which was designed to support people seeking to initiate multi-stakeholder relationships between diverse but equally important research partners. This idea was developed by design team members who decided to collaborate after realizing that their groups were working on related and overlapping challenge areas. The now combined team, comprised of individuals listed on screen, addressed an important but often overlooked need. Studying ways to engage affected populations in health research, this team identified a gap. There's very little information on the upstream step of finding and connecting diverse partners in the first place. Thus, the team sought to enhance knowledge, training, and capacity for people taking this initial connecting step. Their prototype captures and catalogs insights from experienced conveners who often assume the important but unspoken or unlabeled role by taking the first steps to identify and bring together diverse partners, making initial connections, and exploring potential opportunities for collaboration. The team's prototype features several components, including a survey easily disseminated to various stakeholders, which can reach and engage those currently on the periphery of the research field's sphere of awareness. This would drive traffic to the site, orient users to site resources, and highlight pages of interest to each stakeholder type, helping many people see themselves in this work, including those from groups not traditionally represented or included in health research. This public-facing site would include impact stories demonstrating the value of thoughtful, intentional approaches to convening according to diverse stakeholders, people conducting research in different contexts, funders of research, and even patients, public, or members of the general community. The site would feature highlights from a curated collection of promising practices from people who have organically taken on convener roles and who have identified strategies conducive to success. The site would also offer reading resources or other forms of evidence to help conveners understand and explain to others the rationale and approach for using recommended methods. This portion of the site would be designed to help people get a behind-the-scenes look into convening responsibilities to begin understanding the value of this role in research partnerships. Regardless of the stakeholder type, all site visitors could view this content and start envisioning concrete steps they might take to enhance convening activities and set strong foundations for collaboration in research. Beyond these publicly available resources, a dedicated community hub would be available for those especially called to learn the art and science of convening. This would house applicable, adaptable tools and templates to support teams in implementing truly co-designed, co-developed, or co-led research projects, such as sample communications to support outreach to new partners, or sample contracts to help structure and formalize those partnerships. In addition to project and partner management features and peer connection or mentoring channels, the Convener Hub would also offer a distinctive element. It would include the full and detailed documentation of guidance sourced from conveners who have a successful track record in developing sustained and mutually supportive research partnerships. The team came to realize that this human component of the work, while most difficult to describe or demonstrate, is actually the most crucial driver of success, or the secret sauce needed to establish equitable, high-impact research partnerships. This resource would serve as the first of its kind by documenting these important elements of convening so the methods can be taught and used to train emerging leaders who will formally assume convening roles in future. While there has been incredible work in the fields of engagement and citizen science, as well as community-based participatory research, or CBPR, the team learned that little has been done to explore this foundational upstream work, which is often overlooked and underfunded. They also learned that this work is fundamentally driven by human connection, and teaching or training in these areas therefore requires a human element, such as participation in mentoring or peer-to-peer learning relationships. Finally, the team learned that the convener role can be played by any member of a collaborative research team, a funder, a researcher, or a community member. If successfully implemented, this work could lead to the creation of a new and needed community of practice, offering standardized training and earning itself formalized streams of funding. This would support capacity building for the field by expanding the reach of researchers and funders through engagement of partners currently on the periphery of the research landscape. It would also lead to widespread uptake of best practices recommended by experienced conveners. By normalizing their kind of sustainable, equitable collaboration, we can increase the impact of research dollars, leading to the production of relevant, timely, and high-quality research to improve real-world health outcomes. Thank you.